Hello, can you guys hear me? I have a close button. If not, you can take it. Hello? There you go. I turned it on, the button turned green, and that means go. Okay, that's good. Okay, so good afternoon, everyone. My name is Kimberlynn Luke, and I'm here to talk to you about mental illness. And I'm going to piggyback off of Dr. I called her Dr. too. Pastor Juanita Rasmus. She is my pastor. I am a member of St. John's Downtown, and so we are collaborating. She was virtual, but I'm here in person because I thought after I have a conversation with you guys, you may have some questions or you may have some things you want to say. I have some literature, I have some handouts, so I have a lot of information for you. I will put it at the tables in the back, so feel free to grab what you need. So first of all, let me tell you a little bit about my journey and why I really love NAMI. And have you guys heard of NAMI? Yeah. Okay, so that acronym stands for the National Allowance of Mental Illness. So I don't necessarily work for NAMI. I volunteer for NAMI. At St. John's, we have a support group every Tuesday. We're working on getting more support groups, but if you Google NAMI Greater Houston, you will see support groups that are in the Houston area that you can visit. And they're all simulated to be the same. So if you came to the support group at St. John's, or if there was a support group here, or wherever you would go, they are structured in the same way, so you would get the same information. Depending on your facilitator, it may be a little different. You may get a little different flavor. But at the end of the day, that's how we run NAMI. So I'm actually a nurse by trade. So NAMI is something, again, that I do to help and to encourage, and I love to do it. So my first experience, I think, with mental illness is something that I didn't really even understand. So my mother was diagnosed with depression, anxiety. She had panic attacks. And growing up, now hindsight's 2020, but growing up, we would just always say, you know, mom's a drama queen. Mom's just always got a bunch of stuff going on, right? And as a child, I didn't know the signs and symptoms of mental illness, so I didn't know, and I don't even think she knew. It was just something that we thought, you know, that's just how mom was. We noticed that she panicked in certain situations. We noticed that certain things were just extra and just all over the place. But again, we never put the dots together and we could never really figure out what was going on. So fast forward to 2009 when my father passed, my mom comes to live with me. And so now upfront and personal, and now I'm a registered nurse and I've been a nurse for almost 30 years. Now I know the signs and symptoms, and so now I'm like, oh, okay, so this really is true. So when we're all at the house and we can't leave home, and she starts to panic because she's alone, or she wakes up at 2 or 3 o'clock in the morning and she wakes my son up and knows he has to go to school the next morning. So she's doing all these radical, things that we just couldn't understand. So I took her to the doctor, and of course she was diagnosed with several diagnoses. Now sometimes people are diagnosed, and sometimes you can say, like Pastor Juanita was saying, I just feel different. I don't feel the same. I know something is off. So in our support group, we tell you to come. You may have a diagnosis from a physician, or you just may not feel good that day. You just may have something going on and you want to come to the support group and you want to talk about it, okay? So that was my first kind of encounter with mental illness. My mother has since passed. She passed in 2017. And I'm still seeing and feeling some of the remnants of her mental illness. As a result of that, my mother passed in 2017, and so directly after that, about 17, about 4 or 5 months after that, I started to notice my son, who was 14 at the time, started to be distant, started to isolate, stopped doing the things he loved to do. He was also a football player. He stopped playing football. He stopped playing piano. He stopped hanging out with his friends from high school, from elementary school, just really trying to disconnect. And even trying to disconnect from me, but I recognized the symptoms and I would pull him in as often as possible. First thing I did was got him with an appointment with a therapist, and the therapist diagnosed him again with depression, anxiety, panic attacks. Eventually he got on medication, and even now he has a therapist.
Wasn't that an amazing conference?
So some people say that mental illness is hereditary. Yeah, sometimes they say it skips a generation. So I would like to say that I'm fine, even though I know sometimes I have my days. But my mother and my son definitely have some of the same diagnoses and some of the same signs and symptoms. And I can see it clearly now where I couldn't always put the two together. So let me tell you a little bit about mental illness, particularly for African Americans. 1 in 5 suffer with mental illness. And as African Americans, we are 20% at higher risk of having a mental illness and having the capacity to notice it and to have the resources to take care of it, or to see a physician, to see a doctor, see a therapist, or even talk to someone. And so I want to, Pastor Juanita was talking about some of the signs and symptoms and some of the things that she saw and that she noticed. So I want to share with you 10 common signs and symptoms, and I have some flyers. Feel free to get one. So we'll talk about these. And then I want to see if you guys have any specific questions, because I can stand here, I can talk all day about mental illness. I can talk about depression, anxiety. I can talk about schizophrenia, bipolar. I can talk about suicide. There's so many things that I can talk about, but I want to know if you have any specific questions. Yeah, they're right there. So feel free to pass me those out. And then I have some pamphlets as well. So guys, 10 common signs and symptoms of mental health. The first one, feeling sad or withdrawn for more than 2 weeks. Again, Pastor Juanita just spoke about that. If you notice your behavior, get a journal, start writing things down. And if you notice this behavior has gone on more than 2 weeks, there may be something going on, okay? Crying regularly, feeling fatigued, feeling unmotivated. Okay, secondly, seriously trying to harm or kill oneself or making plans to do so. So a lot of times we say when people are suicidal, that means you want to harm yourself. Homicidal means you want to harm someone else. Have you made a plan? As a nurse working in behavioral health for some period of time, if a patient or someone walked up to me and said, hey, I think I'm suicidal, my first thing was, do you have a plan? And they may tell you, yes, I have a gun, it's loaded, I'm giving away some of my personal items, I'm doing A, B, C, and D, and I plan on doing this tomorrow night at 10 p.m. They typically have a plan. Not always, but they may have a plan. Again, severe, out of control, risk-taking behaviors that cause harms to self and others. So if all of a sudden you want to ride a motorcycle at 2 or 3 o'clock in the morning after you've had 3 or 4 glasses of wine, you're doing some type of activity, mountain climbing, or just doing something that's abnormal, that's something that you normally would not do, but it's risk-taking, because at the end of the day, you don't care if you lose your life, that may be a sign that something is going on. Number 4, suddenly overwhelming fear for no reason, sometimes with your heart racing, physical discomfort, and fast breathing. So this is typically called an anxiety attack. You can have a panic attack, and it will raise your heart rate. It will make you feel anxiety. Sometimes you may even sweat, start to perspire. So all of those are signs of something that something may be wrong. Number 5, not eating, throwing up, or using laxatives to lose weight, significant weight loss, or weight gain. Severe mood swings that cause problems in your relationship. So if you have a girlfriend or your husband who says, hey, you know, one day you're like this, you know, one day, you know, Monday you were calm and you were quiet, Tuesday you were hyper, you were excited, on Wednesday you slept all day, Thursday we couldn't get a communication, you wouldn't talk, we couldn't have a conversation with you. If people are bringing these things to your attention, you may want to think about it, maybe something going on. Repeated use of drugs and alcohol. So a lot of times the drug and the alcohol, individuals take those to mask what's really going on. But again, if you notice someone is taking more drugs, and it could be prescription drugs, so it doesn't have to be a street drug, but you may have a prescription from the provider, and you may be taking this medicine more and more readily. Just recognize that may be an issue for you. Drastic changes in behavior, personality, or sleeping habits. Again, Pastor Juanita spoke about that. If you're sleeping too much, if you can't sleep at all, if you're eating too much, not enough, you're gaining weight, losing weight, notice that all those things may be a sign that something is going on and you may have a mental health condition. Number 9, extreme difficulty in concentrating or staying still. that puts a person in physical danger or causes failure or school failure. So if you are in class or even work, sometimes it's hard to focus. If you just, maybe you have a project and it's pretty simple, but for some reason you just can't finish this project. You just can't focus enough to get this task done. Your supervisor may come to you and ask you questions. You may notice that your children are not making good grades. You know, maybe they're typically an A and B student. Now they're making C's and D's. So they cannot concentrate enough to focus and to do the task before them. And then lastly, ladies, intense worries or fears that get in the way of daily activities like hanging out with friends or going to classes. So if for some reason, I think Pastor Juanita spoke about it. I know she wouldn't mind me sharing. She spoke about on the day that she actually crashed, she got into bed and she literally did not get out of bed for a long period of time. I forget the exact amount of time, but I'm talking weeks. She literally could not get out of the bed. Pastor Rudy would bring her food, ask her how she's doing, ask her that she wanted to go outside, ask her what's going on, and she could not articulate what was going on with her. And she shared with me that it's kind of a dagger in your heart for you to be going through depression and someone come home and say, well, hey, how's your day? Because you don't know how your day was. You can't articulate that, and you feel like everything is, you may have on glasses, but it's rose colors. So what you see, your reality is different than what we see. So staying in bed, sleeping long, not being able to move, or having a different behavior or cultures that your friends recognize, those are all signs and symptoms that you may have a mental health condition. And then the last thing I want to share with you guys is, no worries if you think you have a mental illness or something is going on with you, there's help. So there's NAMI, which stands for the National Allowance on Mental Illness. You can go to NAMI.org and you can look up anything you need to look up. I also brought some pamphlets. I brought things about suicide, sleeping disorders, and a lot of different other disorders that you may have or things that you think you may be going through. But definitely there's a flyer that talks about how to find help, how you can get help, and how it's readily available for you in churches, in organizations, and hospitals, and therapists, psychiatrists. So there's a number of ways that you can be treated and get some help. And perhaps you may need medication, you may not. So it just depends. You know, I think one of the references earlier was diabetes. So if you're diagnosed with diabetes, it depends on if it's type 1 or type 2. You may need medication, you may not. You may need insulin, you may not. The doctor may just say, hey, if you exercise and lose some weight, kind of watch what you eat, you may be okay. The same thing is for mental illness. It's all different. It treats everybody differently. No one experiences the same signs and symptoms. So you may resonate with some of the things that Pastor Juanita said. You may resonate with some of the things that I've said, but none of us will have the exact same signs and symptoms. It will treat us all differently. So looking at my mother and looking at my son, you know, they have the same diagnoses, but the behaviors are completely different. And maybe it's because he's now 18, and maybe because she was 72 when she passed. So age makes a difference, but no one is the same, and no one chemistry, and none of the responses and behaviors will ever be the same. But you can recognize the change, and we're here to help. So, so that's what I have real quickly, because I want to leave time for questions if you guys have any. And you may have a question about a specific handout that was passed out. So, does anyone have anything for me?
Raise your hand, get your questions together. I know one that I have because I noticed this a lot. Mental illness usually will start to manifest in the teenage years and young adult years. Can you talk to that?
Yes, ma'am. So a mental diagnosis, or what, so I need to mention a crisis, a mental break, we call it a lot of different things. Typically, it will start at the age, I'm sorry, I'm moving the mic around. I would say 14 to 21. So if you have children, we typically see this crisis in children in high school, 8th grade, 9th grade, 10th grade, and particularly freshmen in college. So things will be fine. You know, I've known a lot of athletes. They are awesome. They are going to Division I colleges. They get to college that first semester, and by October or November, they are back at home, maybe in a mental health hospital or maybe on medication, but they've had a mental break and the parents don't know why. Of course, they're away at school, so no one recognizes those signs and symptoms. So remember, guys, you only see the behavior. So you don't know what's going on behind that. You don't know that there's a diagnosis. So you just see the behavior. And the tragic thing about that is if your child is away at school and maybe they're driving home, they get stopped by a police officer, God knows what can happen because they're actually in a mental crisis and nobody knows that. And so it's really, really scary. Police officers are trying to be trained. I hear it more and more on the radio and things of that nature so that they can witness and recognize the signs and symptoms, but that's not always the case. So they may think they're drunk. They may think they're just aggressive. They may not know what the behavior is. And it depends on your diagnosis. You may be aggressive. If you're schizophrenic, if you're hallucinating, if you're hearing voices, you're going to be aggressive. And if you don't know what's going on with that child, they're more likely going to end up in jail versus getting the help that they really need. So those are typical ages, but again, I don't want to formulate anyone and say that anyone has to be within those guidelines. Pastor Juanita, I think, was in her 40s when she had her mental break. And again, my mother seemed to get worse and worse as she got older. So again, I think because she had family, she had support, but once my father passed and once she didn't have that continuous help, she didn't no longer have a family. I moved out, my sister moved out, my brother was no longer here. I think she felt alone, and so I think she started having more and more signs and symptoms. So again, everyone's different, but that is a typical age that you will start to see signs and symptoms. However, it can go into your late 20s, 30s, 40s, 50s, or 60s, depending on events. So there's a thing called trigger. So for instance, if, and this is just an example, perhaps I was sexually molested or abused or beaten as a child. There are triggers as I grow up. So, and typically we think about it in our culture, African Americans, some things there's a lot of secrecy, right? Get over it, you're gonna be okay. But when that child gets older, there may be a trigger. So different things will trigger you to remember what you went through as a child or even an adult, and then it will bring that back to you. So we want to be mindful of what our triggers are, and the hope is that you know what triggers your anxiety, you know what triggers your depression, you know what triggers you, and you stay away from those triggers. But sometimes we can't always do that. For instance, you may be going to Thanksgiving every year with your molester. That's a trigger. Every Thanksgiving you get a trigger, but mom says, come on to Thanksgiving. You come and you sit at the table, and you don't really understand what's going on. But every year that's going to be a trigger for you because you know what transpired between you and that other person, but not everybody else knows. So again, treat yourself, take care of yourself, and know that you don't have to be in an environment that triggers you or makes you feel unsafe.
Amen. And another thing too, got a question right here, but I was just thinking about with Pastor Juanita. I've known her for a long time, and she's like the ever-ready battery. That rabbit, right? Go. And she was preaching and teaching all over the place, not saying no. So that self-care, she was running, trying to be everything for everybody, and we can go over the edge. Think we're doing okay because we're doing all of it, but we're really not. We need to listen to our bodies, sit down somewhere, and learn to say no.
Yeah, so
there's a question right there.
Yes, ma'am. Yes, come on up.
I'm a school teacher, and I've had a student that committed suicide, and it hurt a lot for me to experience that. But what is it that school teachers or educators would look out for, in the classroom with students, as a sign that they need help?
So remember, I read you 10 common signs, but there are hundreds of signs because again, we're all different. So I think as a teacher, one thing that you can think about is know that child. And if you see a deviation in that behavior, then you may know something's wrong. Looking at children, do they comb their hair? How are they dressed? Are they eating? Are they being bullied? Are they isolated? Do they walk along the hallway at lunchtime? Do you notice that they sit at a table by themselves and they don't speak to anybody, they don't talk to anybody? What's the relationship with the parents? Oftentimes parents are abusive, but children, they have to come to school anyway. So when you talk about a parent, what's the behavior? Do you see the child flinch? Do they get nervous? Do they get upset? Do they get worried if you're gonna call, if you say I'm gonna call your mom or call your dad, and things of that nature. And then children get triggered. They actually have triggered at school. I had a young lady, I most recently, guys, worked for Child Immigration Services. So the children that are coming across the border, I managed all their health care here in Houston, San Antonio, and El Paso. And I had a young lady who came to one of the shelters. She was standing in line just to get some food. And she broke down, had a nervous breakdown, a panic attack, just full-fledged. And we were like, oh my God, what's going on? She's just standing in line. But back in her country, Guatemala, she was being sexually molested, and these gang lords would line up the children to sexually molest them. So whenever she stood in a line, she recognized that as to be, oh my God, this is what's about to happen to me. And as a teacher, we tell kids all the time, get in line, go do this, go do that, and not realizing that just a simple task can possibly be a trigger for someone. And there's no way you would know that unless you know the child, but just know that the simplest things can be a trigger for a child. Even eating or not eating all their food can be a trigger for them.
You were saying that the age you pretty much preteen, teens, what about younger children? Is it possible in younger children under that age?
Absolutely. I have worked in behavioral health, particularly at St. Joseph downtown and a couple other facilities here in Houston. And we do have pediatrics there. So at Kingwood, there's a facility there where I had a young guy, he was 5 years old. And he was admitted because he tried to, he stabbed his father. So I don't know if the intent was to kill his father, but he stabbed his father, and he was diagnosed with, I believe schizophrenia at the time. It's been about 5 or 6 years ago. But yes, I've seen children as young as 5 be admitted with mental disorders.
And one of the things with the young children, because I had a young guy, he was a kindergartner too, and he was actually hearing voices, he was schizophrenic. And the teacher kept saying, he's talking to the people in the classroom, there's nobody sitting next to him, he's talking to them. So he said them to me. Of course, I had a little history there with the schizophrenia, and know that can be a sign. If they've got imaginary friends, if they're talking to and they're saying they're really, really real, they're seeing things, then it might be good to take them to a psychologist or a psychiatrist, which one?
I always thought with a therapist, but if you have a young child, again, and we've all had that imaginary friend, and we talk to a friend, but if they just keep talking about this friend, and you notice them having dialogue with this friend, and you notice that maybe they're aggressive, typically hurting animals, killing animals, maybe hurting their sisters or brothers, siblings, being really mean to them, all those may be signs that there is a mental health condition.
And I want to also say the most recent one that we heard of, had quite a few, but because of the pandemic and also because of the issues we have now with gay and lesbians and that kind of situation, I don't know if that's the right term to use, but a lot of them are committed suicide because they don't feel accepted and they feel hurt and isolated. So this particular young lady knew she was going to kill herself. She set her alarm clock for a certain time in the morning for her parents to wake up, and that time she had had a message for them. So she did it in the middle of the night, and in the morning, when they woke up and got the message, went to check, and she had checked out. No signs, the only thing she was a part of the gay lesbian group, so we don't know if somebody said something or she didn't feel right. So are y'all seeing more of that?
We are, particularly during the pandemic, we're just seeing a lot, but we're particularly seeing children who are at home, and school is a way for them to get away from abuse, a way for them to get away from bullying, and sometimes the bullying is going on in the home, so it's not always away. So these children use school, even some kids go to school to eat. There's a lot of children who just don't have food at the table. So when they go to school, lunch is the only meal that they get. And so now that school, they're no longer able to go to school, kids are hungry, parents aren't working, they're frustrated. So violence and physical abuse has risen 60-70% during the pandemic, and also in the gay and lesbian community as well, because of the acceptance. And a lot of those children are homeless, and it's really hard if you're homeless to wash your hands and wear a mask because they don't have those resources. So I would just say acceptance is the biggest thing. While we may not always agree with it, they're children, if we can accept them and guide them and get them the help that they need. Because sometimes, you know, they just need to be loved and understood. So that's, it's a really hard time, but we do see a lot of that. We see a lot of the adolescent children, a lot of the athletes, and again, a lot of physical abuse, not just in children, but in adults as well.
Exactly. Okay.
Yeah. I just want I want to say something about the triggers that you were saying. Back home, this was years ago, there was a middle school student. His report card came out, and he had a D and an F. And he kept saying, I don't want to go home. My dad is going to beat me. So he asked the teacher, he said, may I go to the restroom? He went to the restroom, took his lanyard, put it up, hung himself at school. And like I said, the triggers are very important because they didn't see any signs before this. But he was crying, saying, I don't want my dad to see my grades. I don't want him to see my D. I don't want him to see my F. You know, I'm gonna be in trouble. And he went in the bathroom and hung himself.
And that's unfortunate, and it happens a lot. They feel pressure and they don't have a way out, and they don't know who to talk to. And I think over time, for them, they try to make outcries. Again, those triggers can be ever so small. But I've seen that a lot, not necessarily with grades, but also performing. You know, you got involved into a basketball game, you've been to football games, and you hear those parents in the stand. And so much so that you can hear the parents over the coaches. And you watch the children and you watch them, you know, getting clues from the parent versus the coach. And sometimes those can be signs and symptoms of abuse. If you don't perform, you didn't make a certain number of baskets, you didn't score a number of points, when they get home, there is abuse as a result of it.
So you may not be able to see the signs, guys, and you can't feel guilty. Just love everybody. Love your kids. Love your friends. You know, give them the support because you may not see any signs.
Yeah, and typical signs. Some signs, you know, it's rare that a parent, and you all have heard the stories on television where you found children that have been abused, beaten. But most parents, I won't say parents, but most people that are abusers or sex molesters or what have you, they don't want to be caught. So a lot of children, I've seen children when they were admitted, they have scars on their back. They have scars on their chest. They have scars that are maybe high on their thigh. There are places that are not seen. There are places that they're not going to be noticed by a teacher or noticed by a family member or a friend. So again, the goal is to stay hidden so that I can continue the behavior. So they're not gonna blacken their eye. They're not gonna give you a visual sign and symptom. The one that you can watch for also, when you ask me about children, is, you know, if they're wearing a sweater, you know, in August, or a hoodie and sweater. I know these kids now, they wear hoodies year round, but if you notice a change, all of a sudden, you know, you have a young lady or a young man wearing a long sweater or always trying to hide. Another sign, and it's not for everyone, but I know now a lot of kids are growing their hair, so they have long hair. Boys and girls, they just have long hair, particularly boys. So, but if you notice hair that's covering their face, typically that's a sign of depression. I'm withdrawn. I don't want to be seen. I don't want you to notice me. So they have this thing where they cover their face. So hair is always hanging in their face, and if you can just pull that hair back and look into their eyes and kind of, you know, ask them what's going on and how can I help you. You may get some response for that. But so many kids were living in environments during COVID that they didn't have laptops, they didn't have computers, some didn't have lights, so they did the best they can. Some children were telling me they were in their closets trying to do their homework. They didn't want to show their screen. Some schools made it mandatory that you show your face, but some recognize that not all kids wanted to show their home environment. I don't want you to see my room. I don't want you to see where I live. I don't want you to see how I live. So please don't make me turn on my camera. I don't have a comb to comb my hair. I've been wearing these same clothes for the last 5-6 days. So, you know, I don't want to turn my camera on. And so I think a lot of school districts heard that and did not allow the kids. You didn't have to turn on the camera. You just had to sign on, which I think was really good, a really good relief for them. Because that was really stressful for a lot of kids because they didn't have the things. Yeah, it was called bullying. Yeah. So that's the first one. One guy, that first day of school, logged on, And even the teacher made a comment about, man, where you live? What's that? And so, you know, they start making those comments, and again, other children start to bully, and then if they just, you don't want to log on anymore, you don't do your homework or your schoolwork. Right.
I had a question. It seemed like it was real simple for you with your mother and your son getting them help. But typically in the Black community, it's not that easy. I'm just wondering, how are you able to get your son and your mother assistance without them, you know, saying, no, I don't know.
Right. I think for me, being a nurse also helped. So I'm a trauma nurse by trade. So Bental with LBJ, I worked for 24 years. So I'm used to Bental once out. So I'm used to mental health. But for my mom, again, like I said, growing up, I never recognized that it was a true diagnosis. I was like, oh, mom, really, you know, just the way she is. Whenever my dad was a truck driver, so whenever he leave to go on an assignment, I had to come back home. My brother had to come back home. My mom, my sister, like she could never be alone. And we were just like, oh my God. We just thought she was scary. Like, we didn't, you know, she was having a panic attack, but we didn't see that as such. It was like, oh my God, you know. So we would take turns and make sure she was okay. But for my mother, I got her into treatment because she was living with me, and I just kind of took control and said, look, I think you need to see someone. We had a conversation, and she agreed, and so thank God it was easy for me to do. My son did the same thing. By him being 14, when I started to recognize the signs and symptoms, I immediately got a therapist, and I explained to him that this doesn't mean that anything is wrong with you, but let's get some help. Once you have a conversation with someone, let's see where it goes. And so for a couple of years, he did really, really well. But then when he started to withdraw and have panic attacks and meltdown, and my son is really, really handsome. He's a really good kid. But when he started telling me I'm not handsome, I don't feel attractive, nobody likes me, I don't have any friends. And when he broke down and crawled up in the kitchen and started to cry, I knew that something else was wrong. And I knew that was more than just a kid going through adolescent hormones. So I really got him into care, and we just have a good relationship, and I've been, you know, communicating with him. But I will tell you that denial is the biggest thing in the African American community. I don't have a disorder. I don't have anything wrong with me. I'm okay. I'm good. And it usually takes sometimes 5, 6, 10 years to get them on a regimen that works. If you come on to any of the NAMI support group meetings, you will hear adults talking about their children or vice versa. And, you know, whatever the disease process is really, really hard. They don't want to see a doctor. They don't want to go to the doctor. And a lot of times you end up calling the police because they get aggressive and the behavior escalates. And I have a lot of parents that are afraid of their children, or vice versa. So it gets to the point where you call the police, and then the police come pick them up, and then they end up going into care. And you can, just FYI, you can voluntarily commit anyone for up to 3 days. So if you think someone is in danger of hurting themselves or someone else, you can call. I'll give you some numbers. It's all on those little flyers, and you can have them examined. And typically within 3 days, they may get discharged. If they find there's a true diagnosis, then they may keep them for a little bit longer. But it is hard. I agree. It's very, very challenging to get someone to admit and to even get a diagnosis, to get them to the doctor, because the word psychiatrist and therapist is taboo. It's a stigma in the Black community. So no one wants a therapist. No one wants a psychiatrist. But it's a necessary evil for us to get healthy and get better.
So I have a 20-year-old, and COVID has affected her college experience. So I've been hearing things like, I don't have any friends, and I don't go anywhere, I don't do anything. And I've mentioned a few times, I think we should talk to someone, but she won't. So like, how do I?
I would just keep trying to talk to her. Sometimes it's good to, like, I think it was Pastor Juanita who said, write some notes. So for the next month or so, maybe 2 or 3 weeks, write down, you know, hey, I'm noticing your behavior is this. I'm noticing you're doing this. You know, you're not combing your hair, or, you know, you're wearing different type of clothes, your personality is changing. Sometimes the friends are changing. Have you guys ever noticed that? Sometimes your children may have a certain group of friends, and then a months later, they have a new group of friends. So if your friends, if your group is always changing, typically look at the denominator. It's typically they're changing because you have behavior that they are, pushing away from. So when that group of friends are tired and they're like, oh my God, then you gotta find a new group of friends. So that's typically the issue. But I would just invite her to a NAMI. You can come and you can sit in the session. You don't have to say anything. We don't require you to, a typical session is, hi, my name is Kimberlynn, I've been diagnosed with depression, and I tell you a little bit about myself, but you don't have to say anything if you don't want to. So you can come in, you can sit down and just kind of gain curve from other people having conversations and seeing how that is. That could be the beginning stage of some anxiety, some depression, and young children more than, I've just seen it more than ever these last 4 or 5 years. They're really suffering with anxiety, depression, bullying. Everybody wants to look alike, everybody wants to be the same. There's no real individuality, and that's really hard.
Well, I think she never dealt with a group of 9 others. 9 other passed in 2017. And so they were very close. So
It could be all of those things, but I would also say another thing that we all need to do is we need to get a family therapist. So when you go to a family therapist, it's we're going, not you're going. And that's a lot of times they need that. It's not just me, because they want to deny it. But I think if you go with her, you say, we're going to get some family therapy. Most of your jobs will give you like free sessions.
EPA.
Yeah, they will give it to you if you work. So I would say do that, to do that and just stay real close to her, call her every day and make sure you're keeping that communication, that door open for her to talk. We had an episode, and I'm going to share this real quickly. The pastor doesn't mind me sharing it, but his mother was diagnosed with schizophrenia. And when she came to live with us, it just made our house upside down. She wouldn't sleep at night. She's walking the floor. She's ranting and raving. She would come and I woke up one night, she's standing on my bed. So, the fear comes in there. That's to let you know you need to get her some help because you don't want her to hurt anybody, not hurt herself or hurt you. And so if you're seeing these things, it might be good for you, even if they're a teenager, young adult, or if they're older, we had to have her picked up. We had to forcefully say, you're going, because she was going to hurt herself or hurt somebody else. And they're reaching out for help. So the person who knows what to do needs to do that tough love and do that if you see it. Don't ignore it. Okay, no matter how young they are or whatever, do what you can do because it's better to do that than to say, I wish I had, done something. So, yeah.
And then there's also, for NAMI, there's also classes for adolescents. So they don't have to go into adult classes. So there are those that actually have the diagnosis, but because of your diagnosis, then there's classes for individuals that are affected by that family member. So again, mental illness touches each and every one of us. You cannot deal with a family member that has mental illness and it not affect you. My mother also kind of turned the house upside down. Like, it was always something. Yeah. So you have to learn how to deal with that, but it's really, really hard.
Right. And so once you get them on the medication and things like that, things are so much better. And even young.
Sometimes, like I said, sometimes it takes multiple years.
Take a long time.
And sometimes not every medication works for everyone.
Yeah.
So just get ready for the long haul. And it's not something that's going to end. Mental illness does not end.
Yeah,
you live with it, and that's why we tell them, it's not who you are, it's a part of who you are, and we try to deal with it and
And there's no shame in that. Like Pastor Juanita said, when she felt like she was better, she said, I don't need that medication. If you stop, had a relapse. So you have to learn that this is my diagnosis. You have high blood pressure, you take your medicine. I have diabetes, I take my medicine. You have mental illness, you take your medication. So you don't make it seem like a stigma, okay? So you were great. I'm sorry.
So from a different perspective of Miss Jo, because I feel like she stands in similar shoes with my mom. Like, I know COVID cut off my sophomore year and my junior year completely because I stayed at home. And so I started having really bad anxiety and pretty much depression, and I'm glad my mom noticed it. And I started having anxiety attacks, and I was like, my life is so boring. I don't talk to anybody. The world is all falling my mom offered help, and like your daughter was like, nah, it's not really a thing where you think you need help, you just want to go back to normal.
Yeah. You don't know how to get there.
Yeah. Yeah, exactly, which is something that I'm really excited for, I'm sure she is. But I want to say, like, it's just knowing that you notice is always a good thing. Knowing that you offer help is always a good thing. But it's little things like for me, going to church and choir rehearsal, that was a normal thing for me. So it helped me to get better and things like that. So it's just, it is a stigma, but this time has been hard for a lot of young people in a lot of different ways. And I could really relate to that because my mom passed in 2018 and I was close to her. So it's a really similar situation. But I think, because my generation, believe it or not, we're kind of open to the idea of mental health. Even the young black kids, we're a lot more open to it than our older people in the black community. And even though sometimes we don't need help, or we do need help, but we don't think we need help. Yeah, it's just knowing that we have the support and we can talk about it openly without like it being like, oh, you just acting funny, you'll be over it. You know, it's just teenage.
Don't push it off.
Don't push it off.
Don't judge.
Yeah, don't judge. It's a serious thing. So like little things like whatever your daughter likes to do when things were normal, however normal it can get nowadays, because you know things have changed. Little things like that can really help. You know, but I'm sure it means a lot that you even notice it because for me, my anxiety attacks, it would happen in silence. I cry, I freak out, I start shaking, but I was completely silent.
Yeah.
So she had to notice it for me to get better. So it's just good that you noticed it already.
Right. In the room with your door closed, right?
Yeah.
And that's another thing. Don't let them isolate, go in their room, close the door. My son's door stays open. When I noticed he was going through, you know, he didn't want to go to prom, he didn't want to participate in any of these little activities. And I said, you're gonna, right now, this is what you're feeling, but in 5 or 10 years, you're gonna hate that you missed it. So thank God he got a date and he went and he enjoyed himself. He didn't stay long, he stayed a couple hours. Because again, people make him nervous, anxiety. He can't be in a room full of too much stimulation. But at least he went, at least he enjoyed. But I pay attention, listen to your children, don't let them isolate. Things that they love to do, don't let them quit, don't let them stop. Because I would, you know, he quit football, he quit piano, and he's been swimming these last 4 years in high school, and I would not let him quit swimming. I made him go to practice. This is something that you're gonna do. And I think you're right, this generation is more open. That's when I said, I think you need to see someone. He was in agreement. He said, okay, Mom, I think you're right. And he's even in agreement to take his medication. So it wasn't really difficult, but it's been something we've been dealing with for like the last 4 or 5 years.
Wonderful, wonderful. Okay, y'all.
Oh, wow, wasn't that an amazing conference? And I told you, God would not let us down. Every year he is refreshing and renewing in what he gives to us at this conference. So I want to thank you for coming and join us again next year. Tell somebody about the conference. Use your voice to spread the words that you have been given. So I'll see you next year at Women at the Feet of Jesus 2022.